Hi class, it's Miss Moran here. Today I'll talk to you about step-by-step chapter 18. We'll go over a few items there. This is a short one. Deals with the hemic, lymphatic, and mediastinum and diaphragm coding. So we have subsections for excision, repair, and introduction. And divisions are spleen, general lymph nodes, lymphatic channel. And spleen can easily rupture and cause massive hemorrhage, which may require a splenectomy. So a splenectomy can be total or partial. So you want to pay attention to those words, total or partial, whenever you're doing your coding. Uh, the splenectomy is often done as part of a more major procedure. Uh, if there's a bundle in there, into a major procedure, you do not code the splenectomy separately. Always check for bundled procedures. Under general heading, the codes are divided are based on aspiration, biopsy, harvesting, transplantation, and we have types of cells. Allogenic is a close relative. Autologous is a patient's own, and hematopoietic progenitor cells, HPC, those are taken from the bone marrow. That's where our cells all begin. We have peripheral blood aphereses and umbilical cord blood. So this is where we can find these progenitor cells. Two types of lymphadenectomies. We have a limited, it's the lymph nodes only, and a radical, which is the lymph nodes and the surrounding area. The term complete is the same as radical in a neck resection. Lymph nodes and lymphatic channels are listed in your book. You'll have a picture there. So we see all of these different areas where we have the lymphatic channels, all the way from the submandibular all the way to the mediastinal nodes, the arteries, and the codes for these channels are unilateral codes. So this would be for the channels are mentioned because if there's a lymphadenectomy done in the lower jugular nodes, for example, we need to think of the anatomy and stick to that area when coding. We have the term modified radical neck lymphadenectomy would be the removal of all the lymph nodes routinely removed by radical neck dissection. And but the internal jugular vein would be preserved as well as the spinal accessory nerve and the sternocleidomastoid muscle. And again, this is a unilateral procedure. So if it's done on both sides, you would want to use a 50 modifier, 50 modifier. Lymphadenectomies, again, often bundled as part of a more major procedure like a prostatectomy. Do not unbundle and report a lymphadenectomy separately if it is done as part of the prostatectomy. Mediastinum, there's not too many codes for this right over here. This is the area between the lungs, and you have a figure in your book there, and you can see here as well. We have the codes are assigned by approach, incision codes for foreign body removal or for biopsy, and we have excision codes for removal of a cyst or tumor. So remember, incision or excision. There's endoscopic procedures as well, and there's the term repair under that subheading. Then we have the diaphragm. There's only one category, it's repair, and most of the repairs are done for a hernia or laceration. The codes are indexed in the CPT in the back of the book under the word diaphragm. And that's the conclusion of chapter 18. Hope you have a great afternoon.